Hi, everyone. Thank you so much for joining us tonight. My name is Elise Hausman, and I am the APTA Student Assembly Advocacy Project Committee Chair this year. I am a recent graduate of the University of Florida just last week, and thank you all for joining me this tonight for our second annual virtual National Advocacy Dinner that has been put on from the Advocacy Project Committee. This event means so much to me. I was able to serve on the Advocacy Project Committee last year as a member and take over as chair this year. Just a little bit of a background on National Advocacy Dinners and the Project Committee in general. So the National Advocacy Dinners, or NAD, was created in 2015 to facilitate conversations about physical therapy advocacy and really encourage student involvement. National Advocacy Dinners are a way and a platform to correlate with the advocacy efforts, usually the Federal Advocacy Forum that usually happens in the springtime every year. Again, this has been a little bit different due to COVID. There hasn't been a Federal Advocacy Forum in correlation with the National Advocacy Dinners this year, but the APTA staff has been working so diligently to put forth their advocacy efforts and get some information out to us as students so that we are able to learn about the advocacy efforts that the APTA has put forth thus far. So I just thank everyone who has joined us on the panel tonight and everyone who is watching from Facebook at home. Again, I know that this is a little bit different, but everyone in the project committee has been amazing, and everyone for the APTA has been great and really put forth a great event tonight. So we have lots of different speakers. We have individuals on our project committee, other students who are involved with advocacy within the profession, APTA staff who are just so vital in moving the profession forward and communicating with legislators so that we are able to get the best access and care to our patients and really move the profession forward. So it's going to be an amazing night. Thank you all again for joining us. So our first speaker is Laura Keeble, and she will be presenting an overview of APTA advocacy with a focus on what the APTA has been doing in advocacy over the past year. Laura is the grassroots and political affairs specialist within the APTA. Before joining the association in 2019, she was the advocacy program and events manager of the American Cancer Society Cancer Action Network, where she ran the society's largest event, the Leadership Summit and Lobby Day Legislative Fly-In. She also was the manager of grassroots advocacy and the Arthritis Foundation. There she grew and expanded their advocacy program and trained hundreds of volunteers how to advocate. Laura worked on Capitol Hill and went on the campaign trail with a state ballot initiative in Ohio. She graduated with a bachelor's degree in history and political science from the University of Dayton in her hometown, Dayton, Ohio. Laura, thank you so much for being here today and for all the work that you have done for advocacy within the physical therapy profession so far.
Thank you for having me tonight, and thank you so much to the Advocacy Project Committee for putting this amazing event on and for teaching students how to advocate and how you can be advocates throughout your career. So I have a couple slides to show you to add to this presentation here, and can show you about some of the work that we do here at APTA, some of the advocacy programs that you can get involved in. But advocacy directly impacts the physical therapy profession and the future of the profession. We have to work on all levels with all political parties all across the country to accomplish our advocacy goals. We accomplish these goals by meeting with legislators on Capitol Hill, sending letters from APTA members to members of Congress, going to fundraisers through PTPAC, APTA's Political Action Committee, which you'll hear about later on in this program tonight. And we also work with government officials at places like the Centers for Medicare and Medicaid Services, or CMS, and the National National Institutes of Health, or NIH. And we also submit comment letters on regulations to these regulatory bodies, meet with the administration, and work with coalitions of other healthcare associations. So with our strong grassroots network, which is bolstered by your involvement and active participation, that's essential to our success. And your voice as a constituent is powerful. And legislators want to hear from you, and they have an interest in hearing what the person who votes for them, has to say. And we need PTs and PTAs to educate and work with legislators to achieve these goals that will impact the future of the profession. And there are many ways the APTA advocates. So whether advocating in the halls of Congress or in your district or at the regulatory level, your stories are important and bring the physical therapy profession to the attention of our government officials. And that's so essential. So what are some ways that you can get involved? So we have a grassroots program that is really a 3-tier structure, and that's in place to amplify the voice of the profession and to build relationships with lawmakers and really show the collective power that we have as a profession. And the easiest way to get involved is to join the APTA Advocacy Network. So that's really a big goal of tonight's National Advocacy Dinner, is to grow our APTA Advocacy Network. So if you go to our website, and I believe we'll shoot this link out to everybody who's watching on Facebook and Twitter, this is APTA's strength in numbers. APTA Advocacy Network members receive periodic action alerts, which ask for support on an issue by sending a letter to a member of Congress. And by sending thousands of letters to Congress on a particular topic, this shows support and helps to educate and inform lawmakers. It takes minimal time to be a part of the APTA Advocacy Network, but it makes a huge impact. And sending a letter to Congress takes about 3 minutes. We have a pre-filled out letter for you. So all you have to do is just put in your information, and you can add in your personal story if you want, and it goes right to your legislators. It couldn't be easier than that. And APTA Advocacy Network members also receive information bulletins, which are breaking news updates, as well as a quarterly newsletter to keep you updated. And APTA has 2 places actually to send our action, or to take action and send letters to Congress. The first is our Legislative Action Center, which is open to APTA members only. And the second is our Public Patient Action Center. And APTA advocacy networks are encouraged to ask fellow students, friends, family, etc., to participate by sending letters of their own through the Patient Action Center. I know when we have really big pushes, I always send it to my friends and family and say, hey, send a letter of your own for this. So everybody can do it, and it really does take just a few minutes. So next in our grassroots structure is our Key Contact program. And Key Contacts serve as the liaison between a member of Congress and APTA. We rely on Key Contacts to reach out to their member of Congress when we need their support on legislation, or to sign on letters, attend briefings and know more about briefings, as well as educate them on the physical therapy profession. Key Contacts are encouraged to get to know the staff of the legislator, especially the health legislative assistant, and periodically contact them. And I'll just discuss a little bit more about the Key Contact role here in a minute. And then finally, as part of our 3-tier structure, we have our Federal Affairs Liaisons, or FALs, and you'll actually hear from our New York FAL, Teresa Marco, later on in this presentation, who can tell you even more about the role of the FAL, but they're the state or component advocacy leads. FALs send information to their grassroots membership and components from the Government Affairs Department here at APTA and help identify key contacts and generally rally the folks that they represent to help engage in our advocacy work. So they also assist in coordinating our August recess activities and other in-district events throughout the year. They attend PTPAC fundraisers and, of course, recruit other APTA members to participate in our advocacy campaigns. So key contacts, again, are so important in furthering the physical therapy advocacy because they are the link between legislators and APTA, and they really serve as a resource on physical therapy to their member of Congress. And key contacts must reside or have a business in their member of Congress's district. And there may be multiple key contacts in a district, but usually there are 1 or 2 and a little bit more for senators who represent the entire state. Key contacts establish these vital connections by introducing themselves to their member of Congress and their staff. And getting to know the staff in charge of healthcare is absolutely critical because they have the ear of the legislator on health issues and often advise the legislator, whether or not to support a particular bill. And I know as students, you're just getting started in advocacy and just getting started in your career. And it may be intimidating to get started in this advocacy work, but that's okay. And just remember that the first step is the hardest, but just know that members of Congress want to hear from you and they want to hear your perspective. And your perspective is important and it's so powerful. And many members of Congress, they run for office because they want to make a positive impact for their home and their district, and they represent you. And key contacts, they go to August recess visits. That's the district work period in the summertime where members of Congress go back home and meet with their constituents around their areas. And there's also opportunities to attend town halls, which are a bit bigger meetings to interact with a member of Congress. They can happen by phone or virtually or on social media or in person. Those are starting to happen in person again. But to find out about town hall events, I recommend following your members of Congress on social media or sign up for their newsletter. And, social media, you can interact with them on social media as well. That's always a powerful tool for advocacy. But building the relationship between key contact and legislator and their staff means reaching out to members of Congress and their staff by periodic contact, updates, face-to-face meetings, and just keeping them informed of what's going on in the physical therapy community. It's important for key contacts to let us here at APTA know what's going on because we're working with these legislators on Capitol Hill and want to help strengthen that by showing the constituent voice and just giving us the general intel on how we can help to further our legislative work. And overall, this program doesn't require much of your time, though meetings can take around 20 to 30 minutes, but other outreach can take upwards of 10 minutes. And we always include a guide or a template to help you with your communication with your members of Congress. So how do you get started right now? There's so many ways that you can get started. So just by showing up to this National Advocacy Dinner, that's a great first step. And we're really, really excited you're here to learn more about our programs. So now I encourage you to sign up to the APTA Advocacy Network if you haven't done that already. And I believe in the comments, you'll see the link for that. You can also get our advocacy information on your phone through our APTA Advocacy app. It's available in the App Store or Google Play. And just search for it and you'll find it, and you can sign up for the APTA Advocacy Network there. You can send letters to your members of Congress from the app. You can learn more about them, view training videos, and learn about our policy issues. But the app really makes it easy to advocate from anywhere. And of course, you can become a key contact. Just reach out to us at advocacy@apta.org. And of course, you can support PTPAC and get the support out there that way. And you'll hear more about PTPAC coming up. But just remember, you are a vital part of APTA's advocacy structure and our work because you're the constituent, and members of Congress work for you. You're the expert of what you do, and members of Congress want to hear from you. Your unique experience in the physical therapy profession is important, and members of Congress need to hear it. So please join the APTA Advocacy Network. Thank you so much for showing up tonight, and we really appreciate all that you're doing to help further APTA advocacy. So you're powerful, and we really appreciate your support. Elise, I'll turn it back to you.
Thank you, Laura, so much for that information. Next up, we have an amazing speaker, Justin Elliott, and he will be referencing some information about the APTA government affairs. Justin,
all right.
I'm going to give a quick intro, Justin. Thank you so much for joining us.
Absolutely.
Justin is the Vice President of Government Affairs at American Physical Therapy Association, where he has led the association's legislative, public policy, and political efforts on Capitol Hill since 2015. He has held several positions at APTA since joining the association in 2002, serving as the APTA's Director of State Government Affairs and Associate Director of State Government Affairs. Prior to joining the APTA, he worked at KM Strategies, a government affairs and issues management firm. He was the communications director at Fairfax County for Fairfax County Supervisor Penelope A. Gross, and also served as an advisor on her successful re-election campaign. He got started on Capitol Hill serving as an intern in the offices of Senator Charles Robb and Representative Tom Davis, both of Virginia. He received his bachelor's degree in communications and a minor in political science from Virginia Tech. He is a member of the Public Affairs Council and American Society of Association Executives. A really expansive history in government affairs. Thank you so much for joining us today, Justin.
Of your evening to join us for the 2021 APTA National Advocacy Dinner. So, when we talk about advocacy, we talk about the work that APTA is doing at the federal level. To help guide our work, APTA establishes its public policy priorities every 2 years in conjunction with the start of a new session of the U.S. Congress. So back in January, the new 117th Congress started, and APTA released its public policy priorities 2021 to 2022. And it's done on a 2-year cycle to match the 2-year cycle that a congressional session goes in. And if you haven't seen it already, go to apta.org. You can just put in the search panel of public policy priorities, and you can view that document. Now, when you look at that document, keep in mind, and it's an external document with the primary audience being members of Congress, Hill staff, federal agencies, and it's meant to provide them a big picture and hopefully educate them about physical therapy and the role and value that PTs and PTAs play in the U.S. Healthcare system, and how we can improve outcomes, reduce cost, and transform society. And it highlights policy objectives and issues that is meaningful to the profession and what Congress and the administration needs to do to address. Now, it's not an exhaustive list of all the policies and every single specific bill that APTA is advocating on. It's meant really to provide a highlight the major areas that encompass our legislative efforts. In addition, that we have a lot of issues that have been operationalized. And so this document is really meant to, again, provide background on who PTs and PTAs are, talk about the various settings that they work in, and then I hopefully connect the dots about action items that Congress and the administration can do, again, to help transform society. Now, when we talk about the government and federal advocacy, I know it can sometimes be abstract, and what's the workings of Washington, D.C. can be kind of confusing, to say the least. And when we talk about advocacy from APTA, not only is it the work of the APTA staff team at APTA headquarters, our congressional affairs, our state affairs, our regulatory affairs, but it's our members in all the states and DC who are building that relationship with their members of Congress back in the district. And really working together is how we are able to advance our policy agenda. Now, first, on the congressional side, because there are 3 branches of government: Congress, the executive branch, and the judicial branch. And so on the congressional branch, or the legislative branch, obviously we have the House and the Senate, 435 members of the House, 100 members in the United States Senate, with 2 senators from every state. What's interesting this year in the 117th Congress is we have a 50-50 split in the U.S. Senate, with Vice President Harris serving as the tie-breaking vote in the U.S. Senate. It happens once in a blue moon. Last time it happened, I want to say, was back in 2003 or 2004. So really interesting situation and dynamic in Congress for this session. Now, obviously, when bills are introduced, they go to committees of jurisdiction. And those are committees that we are really working and focusing on building relationships with. Now, on the House side, bills that are introduced in the House that deal with healthcare, that deal with patient access, that deal with workforce, that deal with health equity, the 2 main committees that those House bills are going to go through are the House Energy and Commerce Committee and the House Ways and Means Committee. House Ways and Means Committee, that's the committee that basically has all the money. Now, on the Senate side, the 2 main committees are the Senate Finance Committee. Again, that's the money where the Senate appropriates some of their money, but also the Senate Health, Education, Labor, and Pensions Committee, the Senate Health Committee. Those are the 4 major committees, 2 in the House, 2 in the Senate, that a lot of our work is focused on. But there are other committees that we are working with. We're working with the House Small Business Committee to make sure that we're providing support for our therapy small businesses. We do a lot of work with veterans, so we do a lot of work with the Senate Veterans Committee. So although we have 4 major committees that we focus on, we really are focusing on all 535 members, the 435 in the House and the 100 in the Senate, to get our message across, to educate them, and to hopefully get them to help us transform society. Now, I know a lot of focus is put on Capitol Hill and all the workings of the U.S. Congress. But there's a whole other side of it when we talk about the executive branch and when we're talking about the regulatory advocacy we do at federal agencies. Now, the Department of Health and Human Services and Centers for Medicare and Medicaid Services, CMS, they get a lot of the attention because they deal with healthcare, they deal with Medicare, they deal with Medicaid, they deal with payment issues for providers and patient access issues. But there are so many other federal agencies that we're advocating in front of. Again, we do a lot of work with our veterans. So we're doing advocacy with the Veterans Affairs Administration. There's work that we do in terms of housing and urban development, making sure that PTs and PTAs have a role when we're talking about making sure that that safe falls prevention in the home. We're looking at things in terms of active transportation. And so working with maybe the Department of Transportation to look at ways that we can promote things like active transportation alternatives. And so it's not just CMS and HHS, although they are big players. We're looking at the whole host of various federal agencies that have a huge impact in what PTs and PTAs can and can't do and how it impacts the patients we serve. And just in terms of advocacy at the regulatory side, it's a little bit different. Federal agencies will do what they are called proposed rules or proposed regulations, and they will normally publish them. They'll say they want public comment for 30 or 60 days on an idea or a proposal that they want to be able to do. And that's where our advocacy again comes in engaging members again to make sure that we're providing their voice to be heard with these federal agencies. And so when we talk about advocacy, it's not only sending letters to your member of Congress, but also when there are opportunities to send those letters to federal agencies as well. Now, in terms of, what are some of the big issues right now on Capitol Hill and in the federal agencies? And actually, we can go to the next slide. When we talk about what are some of the issues right now, big issue when we look at talking about access to care, telehealth is huge. Now, prior to the COVID pandemic, this was an issue that APTA years ago saw was on the horizon, and we began to advocate because we saw the value of ensuring patient access, particularly in rural and underserved areas, but also providing that flexibility for PTs and PTAs and providing options for patients. Now, about a little over a year ago, because of the pandemic, a national public health emergency was declared. And Congress gave authority to HHS to basically implement what are known as waivers. And as a result of the national emergency, they temporarily have allowed additional providers, including PTs and PTAs, to be able to provide telehealth services to Medicare beneficiaries. Prior to the pandemic, PTs and PTAs, we could not provide services via telehealth under Medicare. And a whole host of providers, our friends, the OTs, SLPs, audiologists, again, is pretty restricted. But we have been able to do so for the past year because of the pandemic. Now, the bad news, or the flip side of this is that when the national emergency is declared over, these waivers that have allowed us to utilize telehealth, all of that goes away and it resets to how it was before the pandemic. And so we need Congress to act because the past year, telehealth has shown not only to be incredibly popular for Medicare patients, it has improved access in rural and underserved areas. It has helped our therapists and PTs and PTAs to be able to provide options to their patients. And that's one of the reasons that APTA has joined forces with our friends at AOTA and ASHA to support the Expanded Telehealth Access Act, HR 2168. This is a bill that was introduced in the U.S. House of Representatives a couple weeks ago. This legislation, if enacted, would make permanent the ability of PTs and PTAs, as well as OTs and OTAs and SLPs, to continue to be able to provide services to Medicare patients via telehealth. So this is a big issue. We can't go back. We can't have these restrictions placed back on us. We need to ensure that we're continuing to expand access and being able to utilize technology to ensure our patients get the care that they need. So this is going to be a big issue this year. We can go to the next slide. Now, when it comes to Medicare, again, it is the biggest healthcare insurance in the country. It provides insurance to all of our healthcare coverage to our seniors. But Medicare continues to face mounting pressure and inadequate funding. And last year, the PT community rallied in a historic campaign to fight a proposal from CMS that would have implemented a devastating 9% cut to payment under the Medicare fee schedule. APTA joined forces with other impacted healthcare colleagues, everyone from radiologists and pathologists to surgeons, and as well as the American Medical Association, because these cuts were proposed not just for therapy, but to a number of healthcare providers. And thanks to your advocacy, Congress intervened in December and provided new money, over $3 billion to Medicare, which reduced the proposed 9% cut down to 3%. Now, no cut to Medicare is ever acceptable. And actually, CMS should be increasing payment to providers, not cutting payment, especially during the middle of a global pandemic. But it really was the work of our PT and PTA and student advocates who, again, generated over 120,000 letters to Congress in just 6 months and over 30,000 comments to CMS opposing this proposed reduction. But our fight isn't over, and there are additional Medicare cuts on the horizon for 2022, including what's known as the PTA payment differential, which again, not something that is going to be real helpful right now in terms of patient access. And so the fight isn't over. And we need to continue not only to fight these cuts, but to make sure that Congress understands something that we've known all along. Medicare needs major reform. It is health. If we're talking about healthcare infrastructure, healthcare, we need to make sure that we're including reforms and support to the Medicare and Medicaid system if we're going to be serious about it. And so this is going to be big because whatever Medicare does, a lot of private insurance companies follow. And when you have this cascade of cuts to service, cuts to access, cuts to payment, in the end, all it's going to do is impact patient access. And that's not good for the healthcare system. And we could go to the next slide. But there are two other issues, major issues that we're working on that are in particular for our students. One is the issue that deals directly with the student loan impact and the student debt burden. APTA has long been supporting legislation that would add physical therapists to the National Health Service Corps loan repayment program. This would, if this legislation passes, would allow PTs in exchange for 2 years of working in a rural or underserved area, in exchange for working for 2 years in that area, they could be eligible for up to $50,000 in loan repayment. And this is critical because when you look at some of the health inequities in rural and underserved areas, you look at the issue of the opioid epidemic. Those are the areas that are getting hit the hardest because of the opioid epidemic. Now we have COVID, and we're seeing folks who have what are called long-haul COVID. They have symptoms that are going to take months, if not years, maybe never, to recover from. These are folks who have permanent disabilities because of their infection from COVID. And again, it's underserved and rural areas that are also particularly hit hard. So not only will this address the student loan debt or help address that, it'll also make sure that we're getting therapy into areas that are currently underserved. And that legislation will need to be reintroduced again into this new Congress. We are hopeful that it'll be introduced in the coming weeks. On the House side, Congresswoman Diana DeGette from Colorado is going to be the lead sponsor on the House side. And on the Senate side, it will be Senator Tester, Senator Wicker, and Senator King leading it in the Senate. But another big bill that was introduced during the last Congress and actually got through the House of Representatives, and we're waiting for the Senate to take it up when the pandemic hit, is the Allied Health Workforce Diversity Act. Now, this bill is critical because it also supports APTA's strategic priority of diversity, equity, and inclusion. And this legislation would increase opportunities from individuals who are currently underrepresented in the fields of PT, OT, and speech. That includes individuals from racial and ethnic minorities, people with disabilities, folks from economically disadvantaged areas of the country. This would provide funding to accredited higher education programs for them to be able to recruit and retain individuals who are currently underrepresented in the physical therapy profession. And so that includes doing community outreach, creating mentorship programs, tutoring programs, providing scholarships and stipends. And so this again is one of our signature bills, one of our bills that we'll be advocating on that, again, we anticipate will be reintroduced in the 117th Congress in the very near future. And we can go to the next slide. But there's a whole host of other issues that we're working on. Everything from locum tenens under Medicare, which again would help PTs be able to bring in another physical therapist to cover their patient load temporarily under Medicare if they need to go on maternity leave, or if they have a vacation, or if they're out sick. This would allow folks to be able to bring in temporarily, again under Medicare, a PT to cover their workload. We also want to be able to have physical therapists and physical therapist assistants to be able to do what's known as opt out of Medicare, so that they can privately contract with Medicare beneficiaries. Now, that legislation has been introduced. Let me back up just a little bit. The locum tenens bill, that bill has been introduced in the House. It's HR 1611. The Medicare opt-out bill is now in the Senate. It's Senate Bill 826. Another bill that we are supporting is the Lymphedema Treatment Act. APTA is joining with a whole host of national organizations to, again, push for additional Medicare coverage for patients who have lymphedema. But we're also working on things like adding physical therapists to community health centers so that they can be independent primary service providers in community health centers, addressing things like administrative burden, as well as student athlete concussions. And we're also supporting funding for CDC and the NIH to have dedicated funding to look at and address issues related to health inequities, health disparities, and population health. Federal government needs more money and more support so that we can, again, have a healthcare infrastructure that's going to address these issues when we talk about health disparities in this country. And APTA recently rejoined with a number of national organizations pushing for new funding and new programs within the CDC to help address these issues. But again, those are just a small sampling of just some of the issues that we're working on up on Capitol Hill and with federal agencies. And you must be asking yourself, well, what can I do to get started involved? And at least I'm going to turn it back to you, and we can go on to how folks can get energized and engaged.
Thank you so much, Justin. Up next, our speakers are representatives from the PTPAC, which stands for the Physical Therapy Political Action Committee. We have Sam Zedner and Eileen Carter. Sam Zedner is a third-year physical therapy student at Concordia University in Wisconsin and is currently serving the APTA as the Student Assembly PTPAC liaison. After graduating in May, he will begin the orthopedic residency program through Concordia starting in August. He has been involved with the APTA at the local, state, and national levels and strives to empower other students to be just as involved in their profession. He is eager to continue serving the APTA and the profession as a new graduate and learning how to be a dad beginning in June. Congratulations, Sam, to you and your wife.
Thank you very much, Elise.
Perfect. And we have Eileen Carter, who has received her Bachelor's of Science in Physical Therapy from Eastern Carolina University, an MBA from ECU, and a doctorate in physical therapy from Northeastern. She has been an advocate for our patients in our profession since she was a student both at the state and national level. She is honored to serve on the APTA Private Practice Section Government Affairs Committee for the past 6 years and was recently chosen by her peers as the PTPAC Trustee Chair. Dr. Carter and Sam, thank you so much for joining us. We're really looking forward to hearing more about the PTPAC.
Thank you for inviting us.
Yes, thank you. So Eileen, I guess let's start off. First of all, what is the PTPAC? Let's talk about that.
Sure. Okay, so as all of you have been listening to this great stuff that we've been doing, the PTPAC, I'm just going to say, I can't express it enough, is our lifeline for our profession and for our clients. So it's our responsibility as members of the APTA to be that advocate, to be the voice for our clients, to be the voice for our profession. And what better way is to give to the PTPAC? As you see on the screen, it raises money for the APTA from APTA members. It provides contributions to our members of Congress who are friendly to our profession. And guess what? We can still encourage those that might not be friendly with just a donation from us. It is, like I said, a lifeline, but I want to express to you students that it is our lifeline to your future. So I can't express enough that Sam and I, we've given different examples, and we're kind of going to do like a little fireside chat of how did we get involved. And as your colleague has spoken, she stated that I've been involved since a student, and that was in dinosaur time, and I even have my socks to prove it. So I wanted to let you know that one of the biggest things about the PTPAC is our sole fundraiser to provide access to champion our legislature activities. And you saw all the things that have been happening, all the things that we've done. I can tell you when the Balanced Budget Act came in, if it hadn't been for our advocacy, we would not have, when we had the quote unquote limit for Medicare patients, it actually would have been lower than what it was. We still had to compete with the speech pathologists, and we now work with OT speech and whomever else we have to work with. So I just want to say thank you for inviting us. I can't express enough one thing that my father has always said, that when you give, don't give till it hurts, but give till it feels good. So Sam, back at you. Let's talk some more.
Yeah, absolutely. So like you mentioned, let's talk a little bit about how we both got involved with the PTPAC.
Sure.
And I'll say from a student perspective, my involvement, honestly, it started a little bit by accident, a little bit with some chance and some time. Coming into school, I was a little bit apprehensive in terms of, where my comfort level was getting involved with the profession. But I would encourage all the students watching right now to, take even just baby steps outside your comfort zone. Every week, every month, think about what's one other way that you can get involved with your profession and fight for your patients. Honestly, being in this position right now, I never would have expected it first year coming into PT school. But there's nothing really special about me specifically. It's more just being able to observe the leaders in our profession and be inspired by other students as well. And, asking myself, well, how else can I make change, or how can I contribute to change in the profession? So that's what I would encourage all of you to consider, is how you all can make that, take that extra step, even if that is that baby step. On that slide, speaking of baby steps we can take, the slide that was up at the bottom, you see that the Student Star program. And so within the PTPAC, there's different contribution levels, and a $20 donation, either at one time or through multiple parts throughout a year, would allow you to be part of the Student Star program. And so because of that, you'll get a little lapel pin, which you could wear at conferences, show off to your friends or classmates, other professionals, kind of make a statement that you literally put your money where your mouth is, that you support the PAC. You'll get recognition as well on the APTA website. But I think most importantly, it's a way for you to say, you know what, I'm truly fighting for my profession, and most importantly, fighting for my patients. And I know the conversation can always be a little bit sensitive when it comes to donating money, even in addition to, especially from a student's perspective, student debt. We could make that topic in itself a whole different conversation. But what I want to stress tonight is the idea of value, and that's the biggest term I would put on the point I would like to drive home. Meaning that most of us are going quite a bit into debt for a profession or for an education because we value it. We know what that end goal is, and we're willing to make those sacrifices to get to that point. Other things, we obviously wouldn't make those kind of large sacrifices for because we don't quite value it, such as a movie or some other like media type subscription. I would hope that most of us wouldn't go into debt for just your music type thing. But when you think about even just a few dollars donation makes a huge difference. And if we add up all of the cumulative effect that all of us can have from giving even just small contributions, consider the value that is inherently within that donation in terms of what we as a profession gain, and most importantly, what our patients gain from that small contribution. So that's, again, kind of the overarching theme that I would really love to stress to all the students or other professionals watching this is consider the value that even a small donation can have with the PAC.
Thank you, Sam. Should we share with our students some of the great opportunities we've had in our past?
I think so, yes.
All right. So
Would you like to start?
Sure. So just to give you an idea, some of the fun things you can do as a student and it not be intimidating is you go to birthday party celebrations for your legislatures. I can tell you that that's been lots of fun. You have a little bit of food. APTA helps pay for it. We get to sponsor it. We get our name up in lights, and it's a wonderful way to advocate for our profession and our clients. I will tell you this, that what better way, but this is our 100th year of our APTA profession. Wouldn't it be great if at least 100 students times 100 gave just a little bit so that we could show advocacy for our profession and our clients?
Absolutely.
I will tell you that it's been a pleasure to be able to go out there and talk to students and talk to my colleagues and convince them of why to contribute to the PTPAC. And as Justin, Elliott, and everyone before us tonight, Sam, has expressed all the great things. It's just kind of built on that foundation of why and why not. So I will ask you as a student out there, and I think we've got at least 45 or more now, why not? Why not give to the PTPAC? Why not get involved? This is your lifeline. This is your profession. So doing great little fun things are great. I can tell you that being on Capitol Hill is just phenomenal. It's not intimidating. You get in there, you talk to your legislature. Sometimes it might be someone that's appointed for us as a staff member. They really sit and listen, and they like to hear, as Justin Elliott stated, your personal stories. And I can tell you that we did a great turnaround in discussing things about Medicare at once in my life on Capitol Hill. And we gave those informational things about why having such a limitation on Medicare benefits for our beneficiaries. And we gave clear-cut examples, and our congressmen and our senators listened to us. And that's what it's about. That's why, just get out there and talk, be that one advocate. It might be that you call that senator up and say, hey, I would just like to let you come and meet where I'm working as a student, or like you're getting ready to do a residency. Show you what we're all about. I know that that's happened in the past in my clinic, and it was a wonderful way to advocate for our profession and our clients.
Mm-hmm. Well, thank you very much again for your past advocacy. And to answer your question, why as a student would we get involved with the PTPAC? I always feel it's an obligation to continue the momentum that leaders before us in the profession have developed. I genuinely believe that right now as a student, about to graduate this Friday and go out in the profession, that I stand on the shoulders of giants. And there's so many things that I'm able to do or able to look forward to within my profession that 30, 40, even 10 years ago weren't able to do. And that doesn't just happen by chance. The access to care, the scope of practice for physical therapists, that doesn't just come around because time passes. People have to fight for that and advocate for that. And I think that's what I want to inspire, or I hope all the students and professionals listening tonight are inspired by that, to realize that it takes real change and real action. But even, whoever you are, whatever your background is, you can all take those steps to contribute to that. And so that's why I would encourage all of you to be that dynamite for the profession.
Thank you, Sam.
Thank you, Eileen.
I think that we've said what we needed to say on our part. We love being here tonight. Just remember, advocate and educate, and you will ensure your clients access to health care, and you will help ensure our lifeline for our profession. Thank you so much.
Thank you all. Appreciate it.
Advocate and educate. I love that. Thank you so much, Sam and Eileen. Sam, I think you bring up a really great point about the student debt burden in relation to contributing to the PTPAC. I myself have been a PTPAC student star and donated each year since attending my first PT conference as a first year. And I truly see it as an investment in my future for the profession and my future patients. So I encourage everyone watching tonight and everyone watching the stream later on to go ahead and go to those links posted on Facebook live chat to become a PTPAC student star. So up next, we have a wonderful group of students and new graduates to speak on the importance of advocacy panel tonight. So first off, we have James Nowak. who is just finishing up his 3rd year in the DPT program at Utica College. He is enthusiastic about advocacy for our profession and has given multiple presentations at APTA events on how to get involved. He is a proud member of the orthopedic, sports, and geriatric sections of APTA. And when he's maxed out on NPTE prep, James enjoys traveling, hiking, binging Netflix, and really any activity not involving a textbook. I agree with you, James.
Thanks so much for having me, Elise.
Of course. We also have Angelica Ruiz, who is a 2nd-year DPT student at Florida International University in Miami, Florida. She is currently the Director of Communications of the Florida Student Special Interest Group and a member of the APTA Student Assembly Advocacy Project Committee. Her interests in PT include representation in the profession, pelvic, mental, student health, diabetes research, and mentorship within the profession. Angelica can be found on Instagram and Twitter at the Latinx Doc. So go ahead and give her a follow. Thank you so much, Angelica, for being here.
Really excited to be here, Elise. Thank you.
Our next panelist is Jackie Butch. She is a 3rd-year PT student at East Tennessee State University. She currently lives in Johnson City, Tennessee with her husband and their dog, but doesn't yet claim any state as home. Her clinical interests include adults and pediatrics with developmental disabilities and individuals who use adaptive equipment for mobility and sport. Jackie also serves on the Student Assembly Advocacy Project Committee as well. So happy to have you here as well, Jackie.
I'm grateful to be here tonight.
And then our last panelist is Erin Sales. She is a new professional working in the pediatric outpatient clinic in Rhode Island. She has previously served as the chair of the Student Assembly Advocacy Project Committee. So she was just sitting in my position last year. And she also serves as the student delegate for Rhode Island. She would like to take this moment to tell everyone here that they're already an advocate for their patients and our profession. Thank you so much for joining us, Erin, and really looking forward to this panel. Erin's gonna kind of be guiding it. She has a great background in advocacy as within our profession. So thank you all for being here.
Thank you, Elise. Appreciate the intros. I love it. Okay, panelists, we ready to go? First off, I want to hear your why. What was your spark for getting involved in advocacy?
Well, I'll go ahead and take this first. So for me, advocacy, I think a lot of times when we talk about advocacy, right, it's always been centered on certain issues, right? And for us, of course, it's in the context of physical therapy, whether we're talking about Medicare cuts or access to telehealth, for example. But really, I boiled down advocacy, something as simple as it's a feeling, right? When you want to advocate, it's when there's a feeling in your gut when something's not right. Right. And you feel like you just have to speak up about it or you just have to do something about it. And so I felt like that's something that I've always kind of had a drive for. And that's, when going into the profession, right? Why do I choose physical therapy is, of course, like all of us do, we want to help people. We want to help our patients get better. I'm sure at one point in our lives, before we even entered our programs, right, we saw the benefits that physical therapists provided to people. And so now when you extend that, right, when my kind of why, when I got into the physical therapy program and I started to hear about advocacy efforts, I said, okay. And when I started to hear about some of the issues pertinent to our field, it was one of those things where you get that feeling in your gut, right? And you got to do something about it. And I remember first getting the program and I'd hear about these things and it was awesome. What can I do about it, right? And so I'm so happy for those students tuning in right now. I hope you've been finding out and you'll find out even more that, okay, now what can you do with this? Let's take this passion and run. For me, it was taking the leap in an opportunity. It was an opportunity to get involved with a student organization, our state organization. And that was where I really started to get involved. And it was something I had, like student volunteering wasn't something I hadn't been involved with in college. I was new to the college and the people and all that, but I just took the leap, right? I know Sam was talking about that earlier. Sometimes you just have to try. And of course, I also found trusted mentors. I have to give a shout out, Dr. Jim Smith, phenomenal advocate for our profession. I trusted him to help kind of guide me along the way. And I would certainly recommend that to future and advocates as well and future students to do that. Find a trusted mentor to help guide you along the way, to help ignite that passion for advocacy.
Thank you, James. That was great. If I can just throw in my kind of spark, when I started first year of PT school, that was the last year that the push for the therapy pay cap was being made. And that year it was actually lifted. And for me, being able to be a part of that and see something come to fruition that had so much time and energy behind it. And I know that APTA staff members that are on this amazing NAD know just how much time and energy went into that. I was able to see that, and that really helped push me into advocacy and wanting to get involved. So next, I want to hear, what are your thoughts on what may prevent students from participating in advocacy, and how can we encourage participation? And Angelica, I know you are ready to speak on this one.
Thank you, Erin. Yes, we have met up before and we have talked about this at length. Some barriers to student participation in advocacy include APTA membership, the fee, both national and the state. There's also some confusion about what the APTA even is and what they do, and what the state physical therapy associations do and how they participate with the APTA. So but the first step that I recommend to any student is to find their student special interest group of their state. Find them on social media, ask the professors, do you know anything about the student special interest group? Ask your program director. And that's step one. And that's how I got involved. And that's what opened the doors of advocacy for myself. And it's really all what you make it. I firmly believe that. And once that is internalized, it's work. This is a lot of work, but it becomes clearer for you, like it did for me.
That's awesome, Angelica. Thank you for sharing that. And that is so true. You know, none of us are going to sit here and tell you that it's not work to be involved in advocacy and it doesn't take a little bit of extra time, but as we're all kind of sharing, it's finding that why. It's finding that spark. It's finding that one thing that keeps pushing you along.
Go ahead, James. It certainly does, right? To be truly invested in. And once we talk about things, right, like meeting with legislators and all these different advocacy activities, it's going to take a little bit of time, right? But it's worth it. And again, I think part of that why people might not get involved is some students don't see the correlation, right? It's all these, I think they look at it, some of these abstract things. They don't necessarily understand that, these issues that we're fighting for, this directly impacts what you can or cannot do when you're in the field, right? It might not feel real to you right now because you're sitting in the classroom clicking through PowerPoints or on Zoom University, maybe, let's say. But in a couple of years, before you know it, it's the real world, right? And then you're going to notice, I can't do this or that in the clinic. I can't provide the best level of care possible because of this restriction, right? And how can we change those things? It's through this advocacy. And furthermore, I think just taking that first leap, if the time commitment seems like a lot to you as a student, if that's super scary, the first thing you can do when you hear the flash action strategies and these other events, right, where you can get involved in just by sending out a tweet, an email, that's advocacy right there. You don't have to march down Capitol Hill. That's phenomenal if you can do that. But it starts with just a simple tweet or an email to your legislator. They will listen to you. 60 seconds or less.
Great point, James. Awesome. Thank you. Okay, so this next one, I'm going to throw it over to Jackie first, but I would love to hear everybody's plans on how they're going to get involved in advocacy as they make that transition to a working clinician.
Absolutely. One big thing for me is maintaining my membership with both the APTA and my state chapter, wherever that ends up being. Currently, I'm in Tennessee, and that's how I kind of got involved in advocacy, was attending Tennessee Day on the Hill. And 2 years in a row, one of our big state efforts is working on our direct access wording in our Practice Act. And that's huge for me. Right now, we're trying to allow new grads to use direct access. Currently, it is written that you have to have a year of practice before you can see direct access. So we're working on changing that. And that's really important to me because I graduate in December. And if we can change that by then I can be seeing direct access patients as soon as I graduate. So that's a huge factor for me.
Yes, that's awesome. That is a great point, Jackie. And if I can kind of speak on my own experience here, I made the transition to a working clinician last year during a pandemic. Definitely an interesting experience, as I'm sure everybody here knows. But for me, one of the biggest things was telehealth. Of course, we were seeing many of my patients through telehealth because that was the safest option at the time. And in my state of Rhode Island, we had special permission to utilize telehealth services without needing to go through any other authorization processes. But when it was brought up in front of the state Senate, they were looking at, should we continue that after the pandemic? And I was given the opportunity to call into those meetings and really talk about why my patients were benefiting so much from telehealth and what access further past this current pandemic will do for patients all over Rhode Island and, of course, all over the country. So I think that'll do a great job of leading us into our last little topic here. What advocacy issues are you most interested in and why? And I definitely want to hear from everyone for this. So whoever would like to go first.
I'll go ahead and jump in. So my first involvement with advocacy was as a first year, and I became really interested in the opioid epidemic. I had a personal story, personal connection to someone really close to me that struggled with prescription opioid addiction in regards to their chronic pain. And that was the first year that the Federal Advocacy Forum was, again, not focusing as much on the repealing the Medicare cap and really focusing on the Choose PT campaign and really getting as much access and reimbursement and physical therapists out there to help combat the opioid epidemic, especially in rural areas. So, you know, that was my personal connection to joining in, advocacy within the profession. And from there, it really transformed into so many different things. You know, I think that's what's great about the profession. We all have different interests in different practice settings. And it's the same thing with advocacy, you know, learning about what is important to your patient population. And I think just being able to find your niche and your personal connection, either with your patients or with someone who is, you know, closer to home to you or even yourself, about healthcare in general, I think is, a great way to really spark that initiative to becoming more involved as a student.
So for me, I would say it's the National Health Service Corps. I think getting physical therapists included within that, I know that's something we've been fighting for quite some time now. And when we look at if getting physical therapists are part of that, I think it addresses multiple issues in one, right? It's providing better access to patients in rural and underserved areas, right? Because once again, like we talked about earlier in the presentation, that what that program does for professionals who are included in the corps there, right? If you work in rural or underserved areas for 2 or more years, you can get up to $50,000 forgiven in student loan debt. And so now not only are we addressing access to patient care, because now we're incentivizing physical therapists to go to those areas, right? And then that leads, right, if we want to talk about fall prevention and those types of things, now our Medicare patients in those areas are getting better access, less falls, less healthcare utilization. I could go on with a sequel of events, right, the benefits to that. But it also start to address things like the student loan crisis, particularly for physical therapists who are incurring such a large amount of debt. And so that's something, being a student who's about to enter the field, of course, that is one of the issues that is pertinent to me.
For me, representation in physical therapy, the profession, is something that is really important. It starts at programs and it goes all the way up. So yeah, I don't know how CAPTI, I don't know how they are involved with accreditation and whether programs have to meet certain metrics for accreditation, if they even discuss ethnicities of students in their programs. So that, yeah, for me right now, as far as I know, it starts with students.
So you guys already heard about my interest in direct access. Another big one that affects all of us as students and new grads and even all of the working professionals is reimbursement, which I know we already talked a little bit about earlier. This not only affects like my salary when I graduate, but also whatever clinic I work in, like the overhead, the ability to keep our equipment current and be able to treat patients in the best way possible. And even if we're treating via telehealth, having the technology to be able to do that, that's all, we need to be reimbursed, be able to afford all of those things. So that's a big issue as well. And my other love is travel. So PT Compact is another one that I am really interested in.
Those are all great topics, everybody. Thank you so much for sharing, and thank you to Elise and the Advocacy Project Committee for asking all of us to be a part of this. We really appreciate it.
Thank you so much.
Thank you all for joining that panel. I think it facilitated a really great conversation. So our next segment is involving advocacy in your career, because we won't be students forever, and it's important to continue this push and passion with advocacy as we become clinicians. So we have Dr. Teresa Marco and Angelica Ruiz, who we just met Angelica, and welcome her back. Angelica serves on the Advocacy Project Committee, and we'll be chatting with Dr. Marco tonight and helping to facilitate this conversation. So Dr. Marco is a board-certified orthopedic physical therapist and certified early intervention specialist with over 20 years experience. She's the owner of Marco Physical Therapy, a private practice clinic in New York City that specializes in orthopedics, adolescents, and pediatrics. When she's not caring for her patients, Dr. Marco can be found in legislative offices in Washington, D.C. or Albany, New York. She is passionate about making a change in healthcare, and she has made advocacy a cornerstone of her practice. So thank you both for joining this conversation tonight.
Thank you for having us.
Hello, Dr. Marco.
Good to see you again. I just want to say thank you to the student panel for your words. It's really interesting to just see your perspectives, and I would definitely love to have some deeper conversations at a later time just about some of your thoughts. Because I think it's interesting how we can kind of weave in, the student perspective versus the clinician practicing like me for 20 years, and just so how you can see that spectrum of growth and just priorities and how they do meet each other. So thank you.
So one of my questions for you, Dr. Marco, is why, from your perspective, is advocacy important for students?
Well, it was interesting. I was listening to you all speak, and I think one of you said it, and that's my answer, because this is your future. Your future is how you will practice, how you will get paid. And maybe that it doesn't seem very important to people now, but it will be later when you have to pay your student loans. I've been paying my student loans. My saying is I'm going to be paying them till I die. So, when you have to think about how you're going to get paid and how you're going to live your life and travel and, buy toys for your French bulldog, things like that. So, but also this is the future of the legacy of the profession that you will choose to leave behind. And I liked what Sam said said before earlier, how he was ready to carry on the work that people have done before him. And that's great. And from my perspective, I want to pass the baton on to the younger generation and have you carry on the work. When I got involved in advocacy, it dawned on me at that time that, wow, there were so many people dedicated to this who were advocacy warriors, I like to call them, and they were all here doing the work. And I never knew, we never knew. And then I came to, the table, and I decided that I want to take up that banner and do the work myself because I wanted to make an impact on that legacy.
Can you tell us more about that process of leading up to taking up the mantle? Like, it started post-graduation, 2 years as a post-grad.
Yeah, so I was very oblivious about any of this. I didn't know about it as a student. I didn't really know about it earlier in my career. I guess I was one of those people, and that's why I feel like I have a unique perspective, because I was one of those people who thought, somebody's taking care of it, somebody's doing it for me. And then I realized, oh wow, there needs to be me. I need to be the person. When I went back to get my transitional doctorate, I took a class on professionalism and advocacy, and it dawned on me through that class that legislators don't know what we do, and they're the ones making the laws that mandate the system that I have to work in. So if I don't like having to fill out a plan of care or getting authorization or using a utilization management company, I realized that, oh, I have some power. I have power to change that and to make the system better. And the power is we have to work on changing the laws. So my aha moment was long into my career, and in the beginning of my career, I was focused on, being a very good clinician, and I really got good at that. But now I've expanded that into realizing that I want to make the profession better for myself, my patients, and for all of you coming into the profession, so that you guys can flourish and it can be better and you can have an easier time and not go through the same struggles that we're currently going through.
I think the word legacy is very powerful, and it takes using it and providing the context around it. That's really important, because the word can be thrown around, but it's important to know the why and the how behind that word. So what advocacy efforts are you a member of, part of right now?
So when I first got involved, I was unsure on where to get involved. There wasn't really a roadmap, and it actually seemed really overwhelming to me, and I had no idea where to get involved. And I think, APTA has done a great job of making it more clear now, but when I first got started, it was a little bit confusing to me. So, I decided that I would go to conferences, and that's where I would make connections, and I did that. And then I decided to join committees. So that was kind of my next goal, is to just try to join these advocacy committees. So at this point, because I wanted to do that, I am on several committees. I'm on the APTA's Public Policy and Advocacy Committee, which is called PTPAC, and we're an advisory committee to the board of directors. And we are the committee that makes the public policy priorities every 2 years. I'm also on the Private Practice Section's Government Affairs Committee, and we do some similar work to what APTA does, but maybe it's a little bit more business oriented for a business owner. I run my own business, so things like, taxes, the PPP loans, all those kind of things. Those would be locum tenens, things like that. And then I am a federal affairs liaison for my state chapter here in New York, and that is the go-between person who kind of informs the state chapter on what APTA is doing on a federal level and just informing members. So I've joined a lot of committees to try to make an impact and just try to be involved, and also stay connected with the students to try to help guide people. So that's how I got started in that.
This is great. This time is so valuable for students everywhere and clinicians, because it's never too late to start advocating, right?
Exactly.
Yeah. Do you have any, is there a memory of a certain endeavor or a commitment that you went through that just sticks out in your mind?
So I would have to say that going to Washington, D.C. and walking the halls of Congress, I tell everyone that I meet when it comes to advocacy, even I'm getting goosebumps just thinking about it right now. it is a magical place. You realize all of the important things that happen there. And when you come to APTA's Day on the Hill, you will pass all the other advocacy warriors and everybody's excited. You might see, people, members of Congress walking back and forth, and you might take selfies with them. Then just getting into legislative offices and just really explaining and educating, like Eileen said, and educate and engage. And you educate the members of Congress on how important what we do is and how we make a difference in everyday life of just average Americans. And when you convey that message to them, they really become moved and they see how important we are. And then that helps them to, want to help us pass the laws that will make an even greater impact. So I would say definitely going to the Advocacy Day in Washington, D.C. It's just really electric. I usually take a lot of selfies and we live tweet it, and I tweet everybody's, and it's just the electricity is palpable, and I love it. It's exhausting, of course, but it is a lot of fun and I love it.
Thank you for sharing. There will be plenty of opportunities in the future. I know COVID has affected Day on the Hill in person, but it doesn't have to, right? This is what sticks out for you, but this doesn't happen in the day-to-day, right? So it's important, just like James said, it's a tweet, it's an email, it's okay to start there.
Yeah, and we are planning on Day on the Hill being in September. It will coincide with the centennial in September. Hopefully it will be in person. We're not sure what will happen if COVID gets worse. We might have to have it virtual, but currently it is slated to be in person. So I recommend everyone come down to Washington, D.C., and it'll be a big advocating party, and it'll be a good time.
It'll replace the centennial celebration from February. Right, yeah. Or can we find you, Dr. Marco, to learn more about advocacy? And you have a private practice. I know lots of students are interested in opening up their own practices.
Yeah, I'm on Twitter and LinkedIn, but I wanted to say, just for students, if they wanted to, jump right in, I definitely would say, and I tell everybody this, not just students, the easiest thing that you literally could do is sign up for APTA Advocacy Network. It is so easy. You just go onto the APTA website under the advocacy tab, and what happens is you'll get a quarterly newsletter with all the current legislative updates. APTA does all the work for you, and then if we need like a legislative push, APTA will send you a notification, and you can just press the button. I've timed it. It takes about 10 to 15 seconds. Your information is already filled out, and it will send a template letter for you to your member of Congress. I like to call this armchair advocacy, things you can do while you're Netflixing and chilling on the couch. Another thing that I like to recommend also is follow your members of Congress on Twitter, on Facebook, engage with them, know what they're into, like, comment. At a town hall in New York, and my state senator, before COVID, I went up to him and introduced myself, and he said, "Oh, I recognize you from Twitter." So, building those relationships, and that's what advocacy is all about. It's about relationships, so that you become a trusted, valued voice for your members and for your legislators, and that, then you can discuss with them the importance of what we do, and you are that valued voice. So yeah, I would say also you could sign up for your member of Congress's newsletter. You would get a lot of good information that way. And also on a state level, you could go to your state lobby day if you want to get involved in state advocacy too. Because one thing I think is important that many people get confused on, and I was confused on too, is that there's state laws and there's federal laws. I know that Jackie earlier was talking about direct access. That's a state law. When we talk about things like dry needling, that's a state law. When we talk about telehealth and payment and Medicare, things like that, those are all federal laws. So there's lots of different avenues for advocacy depending upon what your passion is. So definitely sign up for the newsletter so you can get all the up to date information as it comes in.
There's also an APTA advocacy app, right?
Yes, there is the Advocacy app, and you can download that on your phone. And you can check that. There's lots of things you can do with the Advocacy app, but the Advocacy Network actually is integrated with that. When you get an alert from APTA, it will take you to the Advocacy Center on the website, which is the same. It's the sister of the app, so it's the same thing. They do all the work for you. They make it very easy because they have our name and address from membership, so they've pre-populated the letter for you when it comes time for a legislative push. If you go on the Advocacy app now or on the Legislative Action Center, I do believe that HR 2168, which is the telehealth bill, is on there, and you could just press, take action, and you could send a letter to your members saying, hey, support HR 2168. I know for me personally, I had to close my business in New York for a little while when COVID was at its height here, and I pivoted to telehealth. I had it on my to-do list for 3 years, and then I never set it up, and COVID pushed me to do that. And then I was able to provide telehealth visits to my patients, and it was a lifeline to people so that they could stay active and, not have long-term side effects of being inactive during COVID.
What's fascinating to me is how the app and Advocacy led you to telehealth and, of course, COVID, but it just provided those steps, like the process to do so.
All right, thank you so much, Dr. Marco and Angelica, for that conversation. I do have one final ask for you all that are watching tonight, and it is, I know it's been mentioned multiple times here today, but it's for you to join the APTA Advocacy Network. The link are in the comments of the Facebook page. You can download that APTA Advocacy app on your phone, which makes it super easy and convenient. So thank you all who were involved in the event tonight, and for those who spoke during our NAD, as well as the APTA staff that were involved in a lot of the behind the scenes of tonight's event. I also want to thank the APTA Student Assembly Advocacy Project Committee members. Thank you all for your hard work. And tonight truly kicks off the NAD month, so there will be national advocacy dinners hosted in many states. And they will be talking not only about the national advocacy efforts that the APTA is involved in, but also kind of mentioning some of those state advocacy efforts. So keep a lookout for those events happening in your state. And that concludes the 2021 Virtual National Advocacy Dinner tonight. Thank you all for joining. I hope you have a wonderful rest of your day.